In this video, I'm going to talk about what qualities or sort of like character traits are really important for PAs, which ones make a good PA, or which ones do you need to have if you want to become a PA and be successful. So this is based on my experience working as a PA for almost a decade in a few different specialties. So I'll kind of share some personal experience related to each one of these qualities that I'm going to list off here. All right. So the first one that I wanted to mention is that PAs need to be, assertive. They need to take initiative or be assertive. And so in other words, you're going to have responsibility. You're going to be in a situation where maybe there's other staff members who don't really know exactly what needs to happen to properly take care of your patients, but you do know what needs to happen. And so you need to remind people like, hey, we need to get this done. And they might say, oh, well, there's some delay. And then you say like, okay, but what can we do about that? And then you kind of work together to get it figured out. But there's a lot of situations, so like when I'm working in the ER, where if I don't say anything, something could be delayed for hours and hours and hours and hours. Not always. Sometimes things work fine, but there's many times where things could be delayed almost endlessly if I don't say anything or do anything about it. And so I need to go out of my way to take initiative to try to make something happen, not by being rude or pushy, but by politely reminding people like, hey, any chance we can get this thing done, or what's the delay on this? So polite but persistent and taking initiative. So that's kind of one version of that, but you're definitely going to need to be able to take initiative to be successful as a PA. So number two is maybe the most important one of all, and that is, as a PA, you've got to be flexible and able to adapt. Flexible and able to adapt. And the main reason for this is because you're going to work with so many different people and in so many different systems that there's going to be all these different demands and situations and so forth that you got to kind of adapt to. So one example is I've worked with many different supervising physicians. So depending on what specialty you're in, et cetera, you may or may not interact with your so-called supervising physician regularly or throughout the day, or you may or may not discuss your patients with them very often. But in some cases, you do discuss things with them frequently. And when that's the case, different doctors, different physicians are going to have different preferences. And sometimes it's not about what's right or what's wrong. They just have a certain style. And so if you do things one way and then they hear like, oh, you're going to do that test on that patient, what about this other test? And it may not be right or wrong. It may just be personal preference, depending on the situation. But if it is personal preference, you got to be flexible. So you can say like, well, here's the reason I thought this would be a good idea. But you certainly don't just get into an argument every time somebody has a different opinion. You kind of be flexible and somewhat go with the flow. So you got to be able to adapt. You also need to be able to adapt to different systems, as I was saying. So I've worked at 8 different hospitals or something. And so every different hospital kind of has its own policies and its own ways of doing certain things. And so you're going to go one place and they do things one way, you go to the other place and then they're doing it a different way and you get a little confused. So you got to be flexible and adapt to that sort of thing. Another one is PAs need to be personable. And that's because you interact with so many people, not just the patients, but many, many staff members, depending on where you work, of course. So if you're in hospitals like me, there's many staff members doing different things. And so you got to be able to interact with them in a way that is not excessively off-putting. So got to be personable. And the next one is closely related to that. As a PA, you need to be a good communicator. Why is that? Well, because you're going to have to talk to all these people. And when you're talking to all these people, including the patients, when you're talking to the patients, first you got to get information from them. Later, you got to explain things to them. And a lot of times, they're going to have questions where you kind of need to sell them on something. You need to sell them on a certain plan of action. And so you need to kind of figure out, like, how can I gently persuade somebody that this is maybe the right approach to take? Again, while being personable, while being polite, etc. So those communication skills are very important. And so not just with the patients, but maybe with that nurse that you're working with who is stubborn or something. Who knows? But you got to have some way of communicating with people, even if there's different personalities that can be difficult to work with sometimes. And speaking of patients, PAs also need to be patient. So that's another quality that PAs need to have. Why do you need to be patient? Well, I already mentioned this earlier when I alluded to the various delays that can happen. So this is very relevant if you work in the ER. It would also be true anywhere in a hospital. And if you're in family practice or something, outpatient clinics, there's also going to be delays, but they're different types of delays. It's not like when I order a CAT scan and then it hasn't happened yet 4 hours later, that's a big delay in the ER. But if you're in a clinic, it's not about something not happening 4 hours later. It's usually like days later or something in many cases. But it could also be the same day. It depends on what it is. If you asked your medical assistant to do something and then they didn't get around to it, or they got sidetracked, or they forgot, or whatever, you have to be patient while also taking initiative to follow up and make sure things eventually do happen if the system around you is not quite functioning the way it should, which is very often the case. So that's part of that whole situation. So I've got a video right here where I talk about how you can shadow different PAs, or different ways to get shadow PAs, and how to do it and why you need to do that. And that's really relevant to this, so you can kind of see what the job's really like and see what it takes to be successful as a PA. And a video here where I talked about 5 advantages of being a PA over being a doctor. So that's a little different than what I was talking about here. It's almost like the opposite. So hope that helps. Hope you enjoy it, and I'll see you next time.